Hey guys, welcome back to Community Cares. I'm Dave. I'm the executive director here at Good Shepherd's Clothes Closet.
And I'm Chaplain Chaz Blackburn. I have the honor of being the president of Good Shepherd's Clothes Closet. And today we have a really, really special guest who's out in the community a lot, and I'll let her introduce herself.
Hi, everyone. I'm Jessica Solis, and I actually work for Access to Healthcare. It's basically an organization that hosts a lot of different resources for the community. We'll get into a little bit more about that, but yes, you will see me around, always smiling, dancing if they have a little music. So,
And she likes carnitas, I found
Yes.
out. Yes.
So, if you guys don't know what we're doing here, this is Community Cares podcast. We showcase 3 events that are happening in the community upcoming, and then we also 3 or 4, and sometimes even more than that.
Sure.
But and then we're going to highlight a community resource, and the whole idea is having community conversations with people, talking to people, making sure it's clear that we are in the community and together, and we're better united.
Absolutely. We're stronger united, and especially, in an election year with the political climate, it's so important that we work together and really just support each other and come together. And, we always talk about nonprofits and organizations need to do it more.
Absolutely. Yeah. And that's the whole idea. I mean, that's how this all started was Chaz and I were working 2 different organizations and we were doing an event together, and we were just like, man, more organizations need to be working together.
Yeah.
There needs to be more conversation, to be open and honest, and to showcase all sorts of different things, because every single week we learn something new that we didn't know.
Yeah.
Because there's so many resources out there. So thank you for being here. We really appreciate it.
Yeah, thank you guys for having me.
If you'd like to listen to Community Cares in your car, we actually have a lot of people listening after the fact. So you can find us on Spotify, Apple Podcasts, Google Play Podcasts,
Amazon,
all over the place.
I was like blown away when I Googled it. It's amazing.
Community Cares pops up. So thank you guys so much for listening and sharing. Without you guys doing that, we would not be in the community doing what we're doing. So thank you. We really appreciate it.
Next week is our 30th show, right? Woohoo! That's a big one.
Do we have anything fun planned?
I don't know. We'll get creative.
Do you have a chicken costume we can put you in?
Ooh.
I told you guys I'd wear it if you bought it.
Oh, that's funny. Yeah, we have like this, our board, we have this like this group chat thing. And we go through it all the time. And the president over here decides he's going to post a hot dog costume. And I'm tempted to buy one now.
Well, I committed this summer, to wear one for the hospice house, for Circle Life Foundation hospice house that's opening up, and for the Aces ball game. So I'm going to go on Colo with that.
Yes.
If they buy it, I told them. So
Do it.
because it's $1 hot dogs. It's fun.
$1 hot dogs.
It's good and support a good cause, right?
Yeah.
And we'll see Good Shepherd's Clothes Closet hopefully this year.
Yeah, well, yep.
If you'd ever email that
see.
person. Aces, where you at? I guess you did email last year. It didn't happen. It's going to happen this
I'm
year.
hurt, man. I'm hurt. My feelings are hurt from last year because I wanted it so bad. I was like, I think that'd be so fun.
Well, this year.
This year.
Going to happen.
Denise Mary Blackburn says, yes, let's go.
Let's go.
Let's
do it.
let's have that the chicken
Take
costume.
me out to the
Are you going to support it? I mean, we're all about it. So, if you're wondering, if you're listening and you're hearing us talk about the comments and the other things, this is a live show. We do it on Facebook Live intentionally, and the reason is we want community involvement. We want to have conversations with the community with these community resources. So it's more than just us talking together and you listening. It's more about how can we as the Reno Sparks and Greater Washoe County community and Carson and Tahoe, how can we all be united and have that conversation together? So that's what we're doing here. Thank you guys so much for tuning in. So let's dive into some upcoming events in the community. So Virginia City does this event every year. It's pretty popular, actually. Everyone in town that I know has gone to it, except for this guy over here. So, have Have you gone
Maybe
to it?
me too. I don't think I've been to it.
I like oysters, but not those kind of oysters.
So the Rocky Mountain Oyster Fry, and it's the St. Patrick's Day celebration in Virginia City on March 16th. It's an all-day event. It's a huge festival. It's always packed. Every year I've ever gone, it's packed. And you said you might go this year?
Well, Nevada Donor Network reached out and wanted us as advocates to be there, and I might be there.
For those of you that
We'll see how the weather is.
yeah, they do a whole bunch of tasting, and before I was vegetarian, I did try one.
You know, I like trying new foods. I would try it. It just does not sound appetizing to me.
It does
How
not.
was it?
What?
How was it when you tried it?
I mean,
Fishy?
tastes like chicken.
You had a ball. Huh? You had a ball.
I had a ball.
It was fun.
It was
Yeah.
This is PG, guys. What are we doing? A Rocky Mountain Oyster Festival. It is a fun event. There's a lot of vendors, and they do more than just try that
Yeah, they
stuff.
have a parade too, actually, this year.
Yeah.
I don't know if they do that every year. Do they?
Oh yeah, it's a
cool.
huge event. Like it's one of Virginia City's biggest, and it's funny.
Yeah.
It's very funny. This and the outhouse race, they do that. I think it's later. That one's funny because there's a bunch of outhouses and you're racing and stuff. But I love VC, just the history, just the vibe, everything about it. It's
really
just
unique,
A
yeah.
lot of fun to be around. So
Yeehaw.
they do the ostrich race too, and they do that.
That I've always
Do
wanted
they
to go
really?
to.
Like
yeah.
actual.
Yeah.
You don't know about all this?
Well, I've heard about the ostrich race. I think
How long have you been here in Reno?
since I was like 9 years old. Yeah,
wow,
so I know
wow.
I don't get out a lot.
I guess you got to start listening to the podcast, and you'll know
Yeah.
about stuff. So,
Dang, put me on the spot, dude. But for real.
hey, we talk about all the events going on in the Reno Sparks community every single week. So, and thank you so much for being
Yes.
here. We really appreciate
Yeah,
it.
for sure.
And
Thank you
our
for
second
having me.
event reminds me of this young lady sitting next to me, which is important as far as the empowering women. And I really like this. I'm probably going to go with you, and it'll be us guys with a bunch of powerful ladies.
Woo!
Yeah, that's funny. Yeah, so and it's a great event. So the International Women's Day event at the Unitarian Church at 780 Del Monte Lane in Reno, Nevada. And it's kind of close to like Whole Foods, that area of town, that Kidski area.
Yeah.
And it's a great event. There's going to be a lot of people there, a lot of speakers, and they're going to a lot of different resources representing and to honor
So
women.
what just to honor women? What else? I mean, what kind of speakers?
I'm not sure this year who the speakers are, but last year there were
Gotcha.
speakers and
Yeah.
awards and other things. Do
Awesome.
you know,
Yeah.
Jesse?
I don't know what they're having this year, but yeah, like you said, there were like speakers of, entrepreneur ladies that, thought they could never, or people thought they could never and they did. So,
That's
just
awesome.
basically putting the word out there, like you can do it. It doesn't matter the gender, like you could do it.
Yeah.
And then they had some awards too
Yeah.
for like some of the community resources, which is great. Hazel dropped hers.
Okay. Yeah.
But it was funny, but it wasn't. But
That's awesome. That's an important event.
Yeah, absolutely. It's good for the community. And we're excited to be able to be there, and we really appreciate being invited to it. So
Yes,
thank you
thank
so
you.
much.
Thank you.
We're all about community support and coming around the community. So please, if you're listening to this, and just come and check out the event, be a part of what's happening in your community. It's free. There's resources. There's giveaways. You can learn if you have a family member or a friend who needs resources, or if you need resources too. These kind of fairs are great to be able to learn more about what's in the community.
Yes.
Because it's similar to the show. Like we said, people come on and we had no clue that all these resources do all the things they do, right?
Yeah.
Because you may know the name, you may know Good Shepherd's Clothes Closet, but you may not know we give away clothes.
Yeah.
I know I didn't when I first started learning about Good Shepherd.
yeah.
Right?
Yeah,
And so,
when I asked you, I'm like, oh, so it's free.
it's
like,
free.
for real?
Yeah.
Yeah, so yeah, I love that.
And
Very
it
good
work-
resource.
We're all about giving things away for free to those in need, and we do clothes, we do toiletry items, we do backpacks, we do all sorts of things, and we give it to the people that need it. So,
And
but
it's not just clothes, it's the experience. It's hope and dignity. And I love that new awareness campaign because it's really the experience. It's showing them dignity. It's a beautiful shopping experience out
Yeah.
there. It's clean. And, they're able to come here and be able to interact. And I love our volunteers. They've been here for a long time, most of them. And they believe in the mission, they believe in the cause. So.
absolutely, absolutely, people that believe in the cause really matters for sure. And I mean, one paid staff, over 30 volunteers. And
You didn't start out that way, huh?
No.
And you were drawn in.
it was pretty crazy when I first started working here for sure. I thought there'd be no Good Shepherd's Clothes Closet.
Oh.
So
It almost happened after 27 years, but here we are, a little over 28, and we have an exciting announcement, which
can't
this is
talk
live. We can't talk about it yet, but it has to do with our micro closets. And just shout out to Melina for that $52,000 grant for our new Toyota Tacoma,
Right.
Dang.
2023, to be able to meet people where they're at our locations. We have Bristlecone Hospice House, Circle Life Hospice House, and then the third's going to be announced soon.
Yeah.
So we're working on a fourth and a fifth. It's just really exciting.
it's hard to keep track because we recorded an episode
know.
a few days ago where it's in the future, and we already revealed the announcement. so.
That's really what's fun about live is I get to make you nervous. I'm going to say something and you squinch. And you're
like,
like, oh,
His eyes.
that's it. No going back.
So yeah, a lot of big stuff coming for sure, and we're only doing what we're doing because of you, the listener, the viewer. Without you, we wouldn't be doing what we're doing. It was really the 620 campaign. It was other people coming around us and being a part of what we're doing in the community.
Yeah,
Wow, good.
absolutely.
So did you know all that, Jess?
I
you
didn't.
go.
That's amazing. I love that. So let me ask you something, if you don't mind. So you guys will be basically having the clothes closet coming to the people, or how does that work?
Yeah, so you go
Oh,
ahead.
no, you
no,
go
no,
ahead, Sir
no,
President.
no. Beauty before age. You go ahead. I was nice to you. I'm getting older and I found out you're
So-
quite a bit younger than me.
We're in the grant for our micro closet expansion project.
Okay.
So our micro closet expansion project is where we're partnering with organizations and we're putting smaller versions of Good Shepherd's Clothes Closet in the community. And it depends on the program, what they need, right? So Bristlecone, when that's officially launched, it will be sweatpants, sweatshirts, and other items that help support their program based on their need, right? And then additionally, they'll have a wish list on top of that where they're going to be able to request, it'll be a digital wish list, and they're going to be able to request certain items for their wish list for their program.
Oh, wow.
And whether that's, like a size 13 shoes
Yeah,
or
okay.
whatever,
Yeah.
those kinds of things.
That's awesome.
And additionally, with our partners with the Microcloset Expansion Project, we'll have special days where if they need to come and shop during not our normal business hours, they can come and get some of the things they need.
Wow.
So-
That's amazing.
Big stuff, exciting stuff.
Yeah.
So yeah, the idea definitely was from how can we meet people where they're at, right?
yeah.
How can we be a part of that solution and not just say, hey, we want to help more people? How do we actually most effectively help people?
Yeah.
Because we could just say, okay, now Good Shepherd's Clothes Closet is going to be open every single day. That will solve everyone's issue. It doesn't.
No.
The reality is it doesn't. With the Microcloset Expansion Project, it helps us actually meet people where
Yeah.
they are.
Yeah,
Truly.
various locations. Because, transportation's big. So
Yeah.
I'll be talking about that too.
Yes, you will.
Yeah.
Do you want to add something, Chaz?
No. I was thinking there might be a good collaboration there, actually, especially if we are able to expand to CARES campus and the senior center that we've been in talks about. I think the transportation piece is really important.
Yeah. Awesome.
Yeah. So, thank you so much for loving the wish list idea. And we're just excited for everyone coming around us. I really appreciate
It's
that.
really humbling. I mean, to see the community step up like they have, it's awesome, man.
Yeah, from Good Shepherd to a grant to other partners coming around us to these partnerships where we're actually able to effectively help the people that need help.
Yeah.
Absolutely. And I love the new logo. it's exciting. It's launched.
Yeah, did you see the new logo?
No.
So yeah, we just released a new logo. You can see it up there in the corner on the left, little heart with the hands. There's
so
a big sign
small
up
up
the
there,
front.
though, yeah.
It's pretty small,
Oh,
but
I see.
it's a little blue heart.
Yeah.
We did a rebranding and
Okay.
rolling out in other areas as well, and yeah, having a lot of fun with that. Hope and dignity to those in need.
Yes, I love the heart. That's a nice one.
We can all use a little more hope
Yeah.
these days. I love it.
So our third event we want to highlight is the biggest little Easter egg hunt on the 9th Street.
Ooh, this is your favorite event.
Boys and Girls Club.
You get to dress up like a big bunny.
Do it,
Man,
Dave.
you gotta- oh boy.
Uh-oh.
boy,
I think I
can't
have
do
some
it,
mirrors
man.
somewhere that Lily used to wear.
Can't do it. Biggest little Easter egg hunt. It's a resource fair. They do like an Easter egg hunt. It's at the Boys and Girls Club over on 9th Street. Last year the event was great, and we'll be there. You guys will
I'll
be there.
yeah. Access to Healthcare will be there, yeah.
Yeah, and we're all about community events, and that's what that is another community event. It's a resource fair, but there's also giveaways and other things they're doing. It's pretty fun, so I'd highly recommend going. Learn more about resources and beyond resources. I noticed because one of our volunteers actually is on the board of CASA, and so they put that event on, the biggest little
Yeah.
Easter egg hunt, and she was saying that they are having some bigger vendors there that are paid vendors. And so last year it was like more just resources and
Resources, yeah.
nonprofits and that kind of stuff, but they're changing it up a little bit and hopefully making it more for everyone, which I really appreciate that a lot.
Yeah, I just caught her on the way in, and she reminded me we had a conversation at the Run for Love. And so if you guys are looking for a volunteer opportunity, they need more people for CASA. It's a really important cause to help balance the system and be an advocate for these children. And they are really struggling with having enough volunteers. So please, if you're interested, you can email us at dave@gsccreno.org.
Or-
and Dave will respond to you and connect you guys. But it's really a
Chaz.
great opportunity. And we'll have to have her on, though. I was thinking about that because
I know.
that's a
She's-
really
she's
important
here
cause.
every Monday.
I know.
And she's here every Monday.
She
She's
won't
volunteering.
be mean to me. I'd rather have her
She's-
on than you. Always pick on me.
Ah, buddy. Yeah, I'll be mean. I'll still be mean. It's fine.
That's okay.
That's who I am.
I still love you. You do a great job. So thank you for all you do.
Thank you for all you do, sir.
Yeah, you're welcome.
Pat each other on the back. Go ahead. For the listeners, we're patting each other on the back right now. All right.
Well,
So
that was awkward.
biggest little Easter egg hunt. Definitely come out, come represent, and be a part of what's happening in the community. Last year was a very big event. I think we even posted a video about it on our Good Shepherd page that I
Awesome.
filmed last year. So yeah, maybe we'll reshare it. But
Maybe what do they call boomerang with you with bunny ears?
oh, jeez.
I like that idea. That would be funny.
You're not available that day anyway, right?
I know,
So,
but you can have someone film you.
yeah.
I'll
I
show
don't know.
you.
Oh yeah, see, I like her. She's
I
awesome.
don't think so. I don't think
Oh.
so.
Well, we have a board meeting tomorrow. We could vote on it.
Oh
mean-
jeez. Oh jeez. I'll just conveniently forget.
Just kidding.
The last event we want to talk about is the Silver Summit Baby Shower, and this is actually going to be here at Good Shepherd's Clothes Closet.
Oh wow! I didn't realize that.
And we're going to be moving the racks and stuff, and it's open to the public, but it is they are highlighting Silver Summit members for this event. So that will be here at Good Shepherd, and they're going to have giveaways. We're going to have baby clothes to give away. It's going to be a fun event here at Good Shepherd. So I know last year they had a bunch of raffle items and other things, so they want to do that again. And that will be here at on April 26th, so the end of April, and that's from 3 to 5 p.m. There'll be a lot of advertising out soon on that, so we're really excited. It's a lot of fun, and we're pushing things out, and so be on the lookout. Our calendar on our website is accurate, and there's a lot of events on there already and on our website, those events are for ones that are happening here at Good Shepherd or ones that we're hosting. and so they're all over the place. Please check it out. We're doing a lot in the community right now, but the one I wanted to highlight right now was definitely the one with Silver Summit, because that's the one coming up next.
Well, and it's such an important event because people, unless you've had a child, it is so difficult at certain times in your life, but especially when you have a brand new child or a baby on the way. We're looking at there's Councilman Dare. I can't read it. I don't have my
Hey.
glasses. What does he
Hello,
say?
glad to hear all the great things you are up to. Hey, it's good to see you,
Thank you, Christopher. Appreciate you, sir. And your dad said, "Ha ha ha, Rob McLaughlin."
Yeah, I don't know. Haha, I think he's probably
He is a
laughing
funny
at
guy, huh?
you trying to
The
dress
bunny
me up
ears.
as a bunny. That's
Oh,
probably
gotcha.
what that is.
No, but it kind of matches. This event matches our cliche little saying: "Be the change you want to see in the world." And I
Yeah.
love that because it gives people a good start with their baby. Last year there was all sorts of baskets and
Mm-hmm.
really good stuff.
Yeah, they want to replicate that and do some of that stuff, but here at Good Shepherd. So
Awesome! What an honor.
yeah, we're having fun. It's gonna be a great time in the community, and by that time it's gonna be a little bit warmer. So I think we're gonna have some outside stuff and some inside stuff. So definitely come down, check out the event. Even if you just want to hang out and say hi, we'd love to have
What are
you.
the fun baby shower games? I remember when my sister was born, I went to the baby shower for a little bit with my mom, and they would do count the gummy bears in the bottle, and they would have hundreds
yeah,
of gummy
yeah, yeah.
bears, and you had to guess.
I think I've never been to a baby shower, so
What?
and I don't want to. I avoid them like the plague.
They're fun. I guess they're probably more fun for women for sure, but they have the co-ed ones, and
Yeah.
it's pretty
Yeah,
cool.
I know. People have tried to get me to.
Yeah,
So
you're like, no,
it doesn't work.
Well, you're going to be at one.
I know. I'm going to be at one now. I gotta host it. I'm gonna be throwing things back and forth. Chaz is good for you. Probably talking to me.
Oh, thanks, Rob. You're the man.
Ah, jeez Louise. Jeez Louise. Yeah, we're gonna have a lot of fun with the baby shower. So we really would love for you to come out, be in support of what we're doing at Good Shepherd's Clothes Closet. So now that leads us to our community resource
Dun, dun, dun.
for this week, which is access to healthcare. Hey, Jesse, thank you for being here. Why don't you take it away?
Yeah, thank you again for having me, guys. I'm pretty excited to share. I brought my flyers just to kind of keep me on track and also to show everybody on screen. So basically, one of our flyers that is very generic into everything that we do, it kind of just tells you it's in, most of these are bilingual, English and Spanish. There's some that are only one language, but then we'll have the other one in the Spanish language, so English or Spanish. So basically, it just tells you that we're able to help with many resources, like applications for resources, applications for assistance with like medical discounts. So that one's just a generic one. But I wanted to go into the discount program. So the discount program is our base. Its Access to Healthcare Network was created so that we can help individuals that, let's say, can't afford insurance. At work, they're able to get insurance, but it's just too expensive. They have other bills, or even adding a dependent like a spouse or a child. It just gets a little too expensive once they add everything up. They can go ahead and add their spouse or their child with us. For a spouse, it could be $40 or $45 monthly. And then for a child up to the age of 18, so 0 to 18 would be $10 only. That's as long as you need it. So it's not it's open enrollment this date and you have to be with us for as long as, the open enrollment is, or whatever the case is. It's month to month. You pay your membership. So if you wanted to try us for about a month, 2 months, 3 months, even 6, you can do that. And then if it's not for you or we're not working out for you, then you could just, close the membership.
So,
Go for it.
hold on.
Yeah.
I know you're probably getting into this, but like, how do you qualify for access to healthcare? How do you qualify for
Yeah,
it?
good question. So basically, being uninsured is the main qualifier. As long as you don't have insurance, you qualify to be on the discount program because it is a discount rather than actual insurance.
And what does that mean, discount program? Like just discounted from whatever the normal
Yeah.
Medicaid prices are? Or-
Yes. So what they do is they base it on what would be like the self-pay and so how some organizations do have a self-pay fee. So then we make sure that our contract tops that for sure. The contracts are a little bit different because it depends on the provider and the service. So we do like to say that it's anywhere from 20 to 60% off on the discount. There are some rates that are flat rates, so they don't matter what percentage it is. It's just like a flat rate that the providers are willing to take. It's almost like a charity deal, kind of. So our providers, anything from specialists like gynecology, urology, nephrology, all of that, they go into a contract with Access to Healthcare saying, this is what our members would be paying you. Do you accept? And then, of course, they work out all the yes and no's and all that stuff. Surgeries as well. We have surgeries, so there's also what percentage will the doctor actually take, and what is the hospital fee, what's the anesthesia fee. We have a prenatal program within as well, so women out there that are not able to afford insurance and then their prenatal packet, they can go on our membership for $40 or $45 a month and then have that prenatal packet, which I do have all the flyers for here. And so with that being said, the qualification is uninsured or underinsured, because you could also be insured, but let's say that there's a procedure that your insurance won't cover for whatever reason. We can definitely look at what code that would be. And I don't know that there's a lot of that, but if there were, we can go ahead and see if we can cover that for the individual with a discount, of course.
That's great.
Yeah.
I mean, I just want to reread some of these. I mean, this is, if you've ever had to fill out a food stamp application or Medicaid, it's very difficult. There's a lot to it. So the fact that you guys would help with that for free, Medicare questions and senior resources, free breast and cervical cancer screening, free transportation to medical appointments. I mean, those may not seem like big things, but they really are when you're trying to have access to the medical resources.
To medical, yeah. And see, in that actually, so that flyer, that generic flyer, gives you a little bit of what will be talked about in these specific ones,
That's
of
awesome.
course.
Yeah.
So I do like to bring that one to my events or to anywhere really that I go to, because some people are like, oh, just kind of give me a flyer here. I don't want to hear too much. And I'm like, okay, here, you could learn all about it. I wanted to also mention, for anybody out there that has any friends, family, whatever it may be, anybody out there listening, we do also serve the undocumented population. So with our discount program, we do not ask for paperwork. We do not ask for a social, nothing of the sort. Even if it's a situation where family's visiting you from a different country, they're here on a visiting visa, and they have a medical emergency, they can definitely sign up with
awesome.
our program, and we can definitely get that discounted for them. So it's also like
It's
that.
kind of like Good Shepherd's Clothes Closet, no questions asked. I mean, we have people who come in here with passports, and it doesn't matter who you are. We're not going to turn you away. And, we want to serve everybody. Everybody deserves to be clothed in dignity and to be able to have access to health care.
Yes, yeah, everybody, to us, it's really important to serve the community, and we mean that. It's not well, if this, and that. And then so I wanted to make sure that I said that is for the discount program. We also have, so it's not just medical, it's also dental and vision. So you get kind of like I said, like a whole insurance, but it's a discount. And medical, dental, vision, including the surgeries and prenatal. But we also have the plan separated for anybody that does have insurance at work, but maybe buying the insurance for dental and vision is just too much.
Sure,
Or they don't offer it at their work. Well, we do have a specific one for just dental vision. It's a little bit cheaper. So it's $45 for adults for 3 months. So it gives you basically, if it was like $15 a month.
That's great.
Yeah, and then for the children, it's $15 for those 3 months. So if it was like $5 per month, but you just pay the whole amount up front. And then the next one I have, so this one's a Spanish one. It also has that dental vision in Spanish. This one's the one that talks about prenatal. It's bilingual, and it tells you what like our cheapest plan is, what you're looking at, about like 1,200, which would be like the prenatal visits and all that good stuff. Then a coordinator is assigned to each individual once they join our program. This coordinator goes over everything that they need to pay. So for example, if their primary care doctor ordered them to go to a cardiologist because they're having some sort of heart issue, the coordinator would get that referral, and then she or he would call the individual saying, hey, your doctor sent us this referral. This is the place you're going to call and set up an appointment. So it's not well, where do I go? What's my in-network provider? We call you and let you know who you can go to and what the pricing looks like for that.
Okay.
That's great. What is the dental cover? Is there like what's?
Yeah, so it basically covers anything. The only thing we do like to emphasize is implants are something that unfortunately we haven't been able to negotiate to have discounted because once again, it's based on negotiation with the dental and vision providers.
So yeah, no, and I think that's good. And just so you guys know, Access to Healthcare didn't sponsor us or anything. This is just Jesse's our friend. We know they're doing good in their community, and we just want to highlight resources in the community for
Yes,
people.
yes.
And so that's our whole goal. That's our heart behind this
Yes.
podcast. So I want to, if you can give me kind of some layman's terms,
Yeah.
real quick, like baseline, what's Access to Healthcare's mission?
Yeah, and before she answers that, I just want to add about the dental is that that can be such a hopeless feeling too when you have a
Yep.
bad tooth.
Oh, yeah.
That's some of the worst pain ever, and so I didn't even know you guys offered that. So that's
Yeah.
really great.
I'm glad. I'm glad that you're
Yeah,
listening
see?
here too, and anybody out there too. So to answer your question, Dave, our mission is to help the people that feel like there is no help. The people that feel, well, I'm in a, let's say, I don't want to necessarily say like from a different country or from a different state, but yes, because even if you're within the same country, but you're coming from a different state and you're like, I don't know, my hometown, there was lots of help and I don't know what to do here in Nevada. We're basically a one-stop shop because I will tell you
Wow.
about all the other stuff. So our mission with the discount is to help anybody with medical, dental, vision that they don't believe they can do that here because they don't qualify or let's say due to legal status, they don't have that option.
Yeah.
We have that option.
Do you guys
Yeah.
ever go to the Fiesta on Wells?
Yes,
Yeah,
I love that one.
That's a wonderful event. We
I
go to
I
every
love
year.
it. Yeah, you'll be seeing me there if
Awesome.
you ever
Very
go.
cool.
Yeah, I think you go. Huh? I see you sometimes.
I was there
Yeah.
last year. I
Oh,
saw
you
Senator Cortez Masto
Yes.
and Circle of Life Hospice had a booth there.
Oh, okay.
Because we were trying to educate. There's a lot of people who don't understand the benefits of hospice.
Yeah.
And so there's a lot of great things out there, but
Okay, perfect. Yeah, I'm glad.
they have usually. I was so mad. The ceviche truck that usually is there was not there last
Oh,
year.
no.
So I popped into one of the restaurants on the street, but it wasn't the same as the food truck one. So I hope they're back this next year.
I did actually have, I think it was aguachile, which
Oh,
is
yeah,
close to ceviche.
yeah.
And there was a food truck selling that, and I was like, huh, and it was pretty good actually. Yeah. So yeah, you'll see me there this year. I think I went over that already. So anybody interested, please, we do have a website. So for the discount program, like I said, that's like our main basis, and then we'll talk about the others. We have a website, accesstohealthcare.org. You can check out what providers we have and what counties we're in and all of that stuff. It's based on counties. And it gives you a little bit of kind of what I said, the people that we're serving. So anybody really. We had a lot of people after COVID or during COVID that lost their job and were like, well, I had a condition and ongoing and now I don't have insurance. We don't discriminate based on pre-existing conditions either. So we're here to help.
That's a huge thing right there.
Absolutely. So we were able to help those individuals that felt like there was no other choice. And that's what I'm saying. It's not just for people that may be coming from somewhere else within the community. Something happens catastrophic, they lose their job or whatever. We're here to help.
That's cool.
Anybody actually who got kicked out of Medicaid, we're able to help.
Awesome.
We're kind of the in-between. Aside from that, we do have Women's Health Connection within our organization. So that's an organization that helps women with mammograms and pap smears for free. If they are under, within the guidelines of the federal poverty level. So they're able to do the screening process. And then after that, if there's something that comes up, there is a coordinator that's assigned to the individuals as well. And they would be able to go ahead and proceed and see if there's something that they can cover for them.
And I just want to add that is such a important. Those are such important resources because in hospice, we see a lot of cases where had they caught this early on, it could have been treated so much better. And it's both those are brutal diagnoses. So thank you.
It's a big thing, and we have a lot of members that call in for that. So when we're at the Women's International, I usually hand out those flyers a lot.
What color are you wearing there, Dave? Should we wear like a purple suit or something cool?
Do it.
Let's do it. Let's have some fun.
Oh man.
Come on, Nika. You're always telling them to empower women. Like you're encouraging. Let's come on.
Oh man.
I think it's a purple theme, right?
I have no clue. I don't know.
I don't think the
No?
email said that there was a specific color.
I want to say a
but-
flyer I saw had a bunch of purple, but I
well,
can't
yeah,
remember. I
actually,
might
the flyer it was purple. Yeah, I wear purple.
Denise says, amazing, exciting new information. Thank you, Jesse.
Oh, of course. Thank you guys for listening, and I have a couple others.
You could tell she's a good community liaison. That's good.
I don't know.
That's
it's
okay.
a thing. So we do have a nutrition program within our access to healthcare services. So anybody with a discount or anybody that has insurance that either has free or at low cost consultations for nutrition, we are able to work with almost any insurance. And once again, if you're part of the discount program, it's something that's available. So that'll be either individual classes, group classes, in person, via Teams, so they can work with you. They got it. They do within those nutrition, the nutritionist can offer diabetes self-management classes as well, or any chronic disease for that being, because it's not just diabetes, it's
Can I
other.
see that one?
Yeah,
Oh,
definitely
thank you
right
so
there.
much.
And so for that one, like I said, they do a whole class. I was actually very lucky and able to teach one of the chronic disease classes. It was so cool because I actually learned a lot. Remember what I was telling you earlier about the low calorie? I learned it from there. And so it's been something that's actually helped me lose weight without having, the whole dieting, like excessive dieting, or, I do work out, but, that's just kind of like another way to track it.
Awesome.
And they're very friendly to any individual, no matter what size. There's chairs exercises, there's standing exercises, it's fun. It was really fun.
Is there a support group through you guys for the chronic illness or diagnosis?
A support group like somebody
Like just
that-
for people that are struggling with those issues?
the consultations I want to say would be like the support, because the ladies do follow up with their individuals. They ask them, hey, how's it going? Are you working on the plan? If the plan's not working out, what else can we do for you? And things like
Good.
that. So,
You're probably going to cover it, but do you guys do mental health or any
Yes,
brief-
we do.
Okay, cool.
Yeah, well, within the discount program, so medical, dental, vision, medical, including mental health. Yeah, that
Okay.
is definitely
Awesome.
big. And there are some flat rates for that as well.
Good.
So, yeah. And I wanted to bring this one out too. This one is for nutrition as well, but this one has a little barcode on it that you can scan, so that we're not just saying, hey, come to Access to Healthcare. Wherever you're at, you scan that barcode and it'll tell you what other agencies are out there to
Awesome.
help you with nutrition. So
Great.
that's another one there. We do have our Ryan White department. Ryan White helps individuals with their medication costs. So any individual with an HIV diagnosis, we're able to help with their medication costs. And so I'm happy to say that we help everybody.
That's awesome.
Everybody. We do have our Nevada Care Connection. Nevada Care Connection is the one that'll help you with the application process, as we mentioned earlier, of the food stamps, Medicaid application, housing, electricity. They could actually even find caregiving assistance. And you
Awesome.
asked me about the hospice. They can find different organizations that are doing hospice, and where they can go if it's closer to home. They also do the veterans benefits, and so that anybody can really call and just anything they need. If we don't have it, I always say this is like my motto: if we don't have it, we won't waste your time, but if we do, we're here to help.
I saw caregiving too, and we
Yeah.
just recently had our national recognized caregivers day. So that is such a under realized burden, being a caregiver. You love the person you're taking care of, but it is mentally, emotionally, physically, and spiritually exhausting. And so that's great that there might be some
Yes.
resources.
Most definitely. And then we do have our Medicare Assistance Program, which is owned by MAP. So we are here to help the community that is out there struggling with their application. Once they turn 65, or if they become disabled and they need help with that application process, we're here to help. We don't sell any products. We're here to help with the process of application, understanding all the plans you have available to you. At the end of the day, you're the one who decides. And we do actually, the representatives, They're so amazing. I hear them on the phone all the time because I actually sit right by them.
That's cool.
And they literally go through like the person's, what do you have? What medications do you have? What doctors are you wanting to not leave? And so let's look for a plan that actually goes along with those doctors instead of you having to drop them. So it's so awesome. And lastly, we have our free transportation program. Our transportation program is for the elder, 60 or older, or disabled, or both, of course. So we take individuals to the grocery, to the pharmacy, and to their medical appointments. It is by appointment, so it's not just
Sure,
say, hey,
yeah.
pick me up. It's, you call in. We kind of ask you some demographic information. We tell you how it works. And they're able to go ahead and schedule. So I always do tell individuals, if you guys are interested, like I said, our website is available. And you can go ahead and, as soon as they give you your appointment, call us up, say, hey, I have an appointment in 3 months or so. Set me up already.
That's awesome. Huh?
The sooner the better, because we are filling up very, very quickly. We are telling everybody at least a month ahead because everybody knows about us now. So.
Well, transportation is such a huge issue for our elder population and seniors.
Yeah.
And I know that actually we have Older Americans Month coming up in May. Are you going to go to the big fair at the 9th Street Senior
The 9th
Center?
Street, I hope so.
Oh, yeah. We usually have about 1,500 seniors that come, so you should definitely be there.
Yeah, definitely.
If you want the application, I can forward it
Yeah,
to you.
for sure. If you could,
But yeah, that's such a huge need, and especially just for grocery shopping too. That's amazing.
Yes, I know. A lot of people do get excited about that. They're like, no way you could take me shopping. Yes, way we can.
That's so cool.
Yeah.
No, it's great. A lot of good resources for sure through Access to Healthcare. And I mean, so obviously your resource.org, you guys have volunteers and stuff, right?
Yes.
So how do people volunteer with you to help the people in need?
So right now, the program that I know is, I want to say accepting or at least uses volunteers is the Medicare Assistance Program. They can definitely call our, so the 1-800 number or 844-826-2085. That'll put you with one of the representatives and they can then guide you as to how do you apply for volunteering.
So
I think our website might have it also.
what would the volunteer do then?
As far as I know, because I've never worked at that department, they do process either paperwork, so they do help with claim-related services also at the Medicare Assistance Program. So I want to say they also help follow up with what's the process in the claim that you billed our member for or so-and-so. But once again, if they go to our website or give us a call, they would tell them a little bit more about what it entails.
Hopefully they have Good Shepherd's clothes closet listed for
Yes,
clothing.
we do
You're
have you
awesome.
guys
I
as
love
one
it.
of our community resources. So
Very
yeah,
cool.
yeah, because you know what? So the care coordinator that's assigned to the individual with whatever program they are in, any question that they have, we're gonna have some sort of answer. If they don't have it right then and there, we'll reach out to the other resources that we have and say, hey, do you know of anywhere right now that's accepting, people to come in and pick up some clothes or whatever
That's
the
good.
case may be. So yeah,
Wow.
it's pretty awesome. I love working there.
Yeah, it's
honestly.
definitely in a lot of ways like a resource hub for the entire community.
Yeah.
Yes,
For as far
one-stop
as
shop.
medical and everything, and you'll connect them to different Medicaids or whatever
Yes.
else. I mean, that's beautiful. So-
Yeah. One thing I actually did forget to mention, but I usually, we do have Nevada Health Link within. So when I mean we'll help you with like almost anything, it's literally. So we have Nevada Health Link within Access to Healthcare.
Okay.
So anybody that doesn't want to go for the discount program for whatever reason, wants to actually have insurance rather than a discount, can have a representative shop for them online
Wow.
for Nevada Health Link.
And
Yeah.
so, what drives you then to want to be a part of this?
Yeah, because real quick before you say that, you started out in different roles. If you want to share that, and you worked your
Yeah.
way up. I love that you knew the ins and outs of the organization you're
Yeah.
a part of.
Yeah.
You're so passionate.
So I've been with Access to Healthcare for 5 years, and I did start out as the care coordinator, so one of the individuals that helps the people that are in the discount program. And I was there for 2 years. So I did anything from, surgeries and pricing out the surgery and letting the member know, hey, this is how much it would be. Do you need a little more time? Talk to your doctor. Give them the information about their billing if they get additional billing, from reading and things like that. So I am able to help anytime time I go to any of the fairs that we have, I'm able to tell people, or if they ask me, oh, I was dropped from the discount, I don't know why, I could tell them a little bit as to what might have happened, because there are situations, and we'll explain to people, and we don't just like flat out drop anybody. No, we give them a call. If mainly it's one of our promises to our providers is you will not go without payment. Our members are here, they're getting their discount, and it's such a great discount that you will be paid, you won't have to bill them. So if there's ever an issue with billing, we'll make sure that we call the individual several times. We give them super head notice of everything, and that's one of the issues that I've been able to help out with a lot.
So it's a bridge
Yeah.
between the craziness of medical. I mean,
Yes.
my wife and I were dealing with something medical wise, and it's a real pain. Like
Yeah.
to deal with the hospital, to deal with the different people. Like my wife was just not feeling well. She had to go to the ER, and I'm glad she did. They caught something that they needed to catch, and it was a pain. But I mean, I have resources. I have people I can talk to about
Yeah.
this. Not everyone has that.
Yeah.
And so for you guys to be there for that, to help beyond
Yeah.
what a lot of people would is really cool. So thank you for what you
for
do.
sure. Yeah. And then I also was mentioning to you that I did do the enrollment process for individuals for a whole year. So I was able to get the phone call about what service do they need. Women's Health Connection, the discount program, the MAP program, the Nevada Care Connection, the Ryan White department. So I was one to be able to basically guide the people. Okay, well, this is where you're going to go. This is where I'm going to send your information, and explain to them in detail. Part of the enrollment process for the discount program is explaining everything. I always love to tell them when I was able to get somebody on the phone, or whenever I had somebody on the phone, we're not here to trick you into becoming a member.
Yeah.
No, we're here for you. So you tell us if this works. We're explaining everything, black and white. There's no gray areas. Let us know if this works, and if it doesn't, we understand. But if it does, we're here to help.
Awesome.
Yeah, and then now I've been doing outreach for 2 years, so
so
I
cool.
love it.
A natural, I can tell.
Oh, thank you.
John Gissy, so Chaplain John Gissy, he's a VOA, a Volunteers of America at the CARES Campus supervisor, and also the the displaced populations and homeless team lead for the Great Basin Chaplain Corps. He said, an amazing organization. Maybe I need the vision. I forgot my reading glasses.
With an amazing organization with a wealth of resources. Thank you for sharing all the great information.
Yeah,
So,
that's awesome.
and I echo that. Thank you for being
Yeah.
here. Thank you for taking time out of your night. We
Yeah.
appreciate it, and we love being able to partner with organizations that are helping people. Right?
Yes.
I had no idea.
Crazy.
I had no idea about them. That's
Yeah,
amazing.
it's crazy
Yeah.
thought. Like help people. What?
Yes,
What?
I know. Yeah. and it does make me feel happy. So to go back to your question, what drives me? Honestly, helping so many kinds of situations with what people may come to us with.
fulfilling,
So
huh?
yeah, it really is. It really is. It makes me happy to have fun at my job, because the outreach position, I just love it so much. To be able to talk to the people about it and not hook them into getting into our program, more about explaining.
Yeah.
And when there's people that come to me and they're like, oh, I have insurance. I'm like, you know what? It's not just for you. If you know anybody that is struggling right now, if you have a friend who mentioned something to you, or a friend of a friend said something, let them know we're here to help.
Yeah.
They're not alone. That's my main thing. Nobody, I know that there's people out there that are like, I just don't have any sort of help, but if you give us a call, we're probably going to be able to help you with the issue.
Right.
And once
And-
again, if we're not able to, we won't waste our time. We'll let them know right away.
Well, yeah, you say that, but additionally on top of that, you also try to connect people to other resources too.
Yes.
Like that's what you said is
yeah.
like beyond just like Good Shepherd, right? So
Yeah.
so yeah, maybe you may not be able to help them in that situation, but I mean, with all the different resources in our community,
Yeah.
chances are there's a way to help people.
Yes,
Like that's
yes.
the reality.
Yeah.
Like I mean, we're on episode 29 of
30
Communicators.
is next
And,
week.
and so we have talked about, I mean, at least 25, 26 different resources, and we had a couple episodes where we just kind of talked
Well,
about
even
stuff.
more than that, because we mentioned multiple during the episode. I mean,
That's
it really
true.
has been amazing.
So and so there's and we have learned so much, dude. There's so much in this community.
Yeah.
Like there's so many people that want to make a difference and
Absolutely.
make change happen.
We just have to
Yes.
connect everyone.
And that's the whole idea is like we just want to connect people.
Yeah.
that's what this is.
Yeah.
Right? Like, okay. So Chaz and I are sitting here again. We're learning about another resource. I didn't know all that stuff about access to healthcare. Right? And like there's so much out there. So when people and access to healthcare is a great thing because you can connect people then
Yes.
to all the other resources.
Yeah, yeah.
So, I mean, it blows my mind that there's so many different things. So when people say, "Oh, I don't have help," well, I mean, there's help out there. I
There
swear.
is, yeah.
I swear there's help out there. Now, maybe not for we're on the internet, so chances are maybe someone will come up with something we
Yeah.
can't help them with.
Yeah.
But the reality is there's so much out there. There is.
And if you have any questions about anything you need help with, Dave at gsccreno.org.
Or just listen to our podcast. So
yes.
we talk about all
That's
sorts of
right.
resources.
Hey,
Tune
give
in.
us a call at 877-385-2345. That is Access to Healthcare. And that's why I always say, too, just for the individual that might find something
Sure.
that we may not
Yeah,
have.
no, that's fair.
We won't waste your time. But if we do, we're here to help, honestly. And that is what drives me to be
Right.
where I'm at.
Yeah.
I
and
love it.
There's so much out here. And so thank you.
Yeah.
Thank you for taking time. Thank you for sharing. If you guys are curious on what Good Shepherd's Clothes Closet is, we're a free resource in the community where we give away clothes free to those in need. It's a shopping experience, and it's completely free for those that walk in.
Woo!
You can find out more information.
You're going to make
Oh,
it beat.
oh, there it goes.
Oh, does it?
Yeah, that was not weird. I didn't even
do
know
it for
about it.
mine.
It won't
It
do
only
it. I
does
know.
it for me. Oh, she did it. Wouldn't do
It just doesn't like me. That's fine.
it just likes sincere people, that's all.
Oh my goodness, we've gone off the rails. We've gone off the rails. Look, 51 minutes now. This is
That's
our
a new
longest
record.
episode. It's our new record.
I told you to tell me when to stop
No,
talking.
you did great.
That was great, and there's a lot that Access to Healthcare does. So we
Yeah.
really appreciate it. Thank you.
Yeah.
It's hard to get a lot of that in a short time. Look at the buddy here for the.
We help.
Just do it.
I'm trying to do the tagline, dude.
It's been such a long buddy. I'm like delirious. I'm so sorry.
If you want to find out more information about Good Shepherd's Clothes Closet, please visit getclothes.org. Again, this is an audio podcast. It's on Spotify, Apple Podcasts, all over the place. Just type in Community Cares and we pop up. But we help 700 people a month, no matter what. And we're asking you to come alongside and help one. All right, we'll see you next week, guys.
See you
Thank you so
guys.
much.
Take care.
Bye.
So much fun. Tune in for